So we just wanted to welcome everyone for joining us in this webinar. We can't wait to show you guys this new facility that we have that we just recently moved into. It was a long time coming, but we're glad to show you. Hopefully you guys enjoy it. We've definitely put a lot of effort into creating this space, and then hopefully you guys like it.
So we pre-recorded a video so that everyone could see what we're talking about as we're describing it tonight, rather than walking through the facility and doing a live video. We thought we would just give an explanation of what we're talking about while we're doing it. So you can see this is our entryway. It is a much larger standalone facility, and we have our own parking lot with easy access into the building, handicap accessible access.
As you enter into our lobby, it wanted to be an inviting atmosphere with lots of natural light coming in. So it'll be a nice, comfortable place to come in when you check in.
A lot more space for our staff. They're answering phone calls. Someone can be separately checking patients in while someone else is handling patients on the phone. We have offices to the left of the screen here for our office manager, our biller, and for private patient consultations when we're discussing procedures, scheduling procedures.
And here we're moving into our clinic space where we have 6 clinic rooms, which are much larger than our previous facility. Patients want to bring family members so they can listen in on the treatment strategies we have. It's much more comfortable. Large space for our medical assistants, wide spaces to move around. It's not cramped.
Daylight, big one for me. Show up in the morning and work all day, and going home, especially this time of year, we never seem to see the sun. So it's nice to have a daylight window in our clinic space.
And the centerpiece of this is our lab. So if we want to pause here. Yeah, so we want to kind of make the lab like a central point of this our facility, because I think it's one of the reasons why we do such a good job with what we do, right? So this is kind of what sets us different and apart from any other facility that offers regenerative medicine, whether it's PRP or stem cells, is that we do a manual process. We're able to process a larger quantity of samples so we can treat large areas like spines and discs and big joints. But at the same time, we can also increase the concentration of our biologic so that we know that it's still going to work. So one of the downsides of having a centrifuge, a bedside centrifuge, is that you're limited by the volume that you can inject and the concentration you'll be able to make.
With the extra size, we have capacity. We'll be adding a second hood there to be able to double the volume of cells that we can process at any one time.
As we're moving into our procedure area, we have 2 large procedure rooms. Much more comfortable, especially for sedation patients, with having a CRNA staff in the room.
And I think that's one of the advantages that we have too. Like a lot of patients would say that since these injections can be uncomfortable, having the option of having IV sedation for the procedures is huge for patient comfort.
Yeah, we get a lot of physicians in training and physicians that want to learn about the procedures we're doing, and having the larger OR space allows when our patients are willing to let other physicians watch procedures, allows for a lot more space in the ORs for training and sharing the knowledge that we've been able to glean over the years. Being as experienced in the space now as we are, we're now being recognized as being a training center, and we'll have a lot more room for spreading this knowledge and getting more patients to quality providers to get similar procedures to what we're offering.
So that was our second procedure area, and this is the recovery area. So after patients have their injections, it's a recovery bay, very comfortable, very large. There's a bathroom facility right there. So much more comfortable in this new setting.
So our biggest reasons for expanding into a new facility, location is important. We're staying in the Rochester area. We're closer to the freeways, so it's not quite as far up from the highways. It's a little easier for our patients to access. We mentioned earlier our parking lot is a much bigger and easier place to navigate from our last location. But the number one reason is capacity. We have, with that added lab, with the extra OR, with the dedicated recovery bay, we'll be able to more than double our capacity. The previous location was great for one doc. Two docs worked pretty well. By expanding to a third physician, we were having trouble with throughput. We now have 3 other physicians that are looking to join us in the next year that we'll be announcing as those come on board. And now we have a facility that can accommodate those physicians and the patients that they'll be able to treat.
And along with that too, like as the field of regenerative medicine moves forward, just having the extra space to accommodate any new changes, new technologies that come by, try new techniques. It would be, it's one of the ideas that we have. We want to make the space future-proof so that when new things come on, we'll be able to accommodate that and offer that to our patients as well.
And we have some exciting new treatment strategies coming forward. Sexual wellness, aesthetics, lots of things coming down the
Functional medicine.
Functional medicine.
Yep.
So as these services come available, we'll be announcing and presenting those services.
Got a couple questions here that are coming through on the feed. I think tonight would be a great night for extensive question answers. Our number one priority was to give a good view of what the new office looks like, and not dive too deep into any of the science or any of the things that we're treating. So got a first question coming up. How successful is stem cell therapy for rotator cuff tears? I don't know, Dr. Santana, you want to take that one?
Yeah. So as far as rotator cuff tears, it's for partial rotator cuff tears, it works very, very well. The data shows that it responds really well to those treatments that we do with orthobiologics. When it comes to complete tears, that's when things get a little bit more variable in terms of the data. So from what we know is if it's a complete tear with a retraction of greater than 1 centimeter, usually the prognosis is not very good. Whereas if it's less than that or a partial tear, then usually it's a pretty good prognosis. Now, with that being said, from what we've seen here in the office, a lot of times for those patients that have those kinds of tears, those kinds of issues, it's still a good viable option to try the regenerative treatment for 2 reasons. One is that if it works, great, then you don't have to do any type of surgery. The second one is if you do end up the treatment not doing well or the goal is not met to heal it, it still doesn't preclude you from having the surgery in the first place. And then hopefully at that point, the shoulder might be a little bit healthier, a little bit better, so that when you do the surgery, it might be a faster recovery. As another option that we do is for severe shoulder issues where surgery is the right answer. We can usually augment the surgical treatment with PRP or stem cells in order to accelerate the healing of the surgery. So there's different ways that we can kind of look at it. Obviously, each patient has different needs and different requirements, and we will tailor the treatment based on what's needed.
Great. Yeah. A couple other questions coming in. One asks, are there any plans to expand to the west side of the state? So happy to tell you we do. We have launched a clinic in Lansing. So we've been going there for a couple months, and we've identified a space in Grand Rapids and a physician in Grand Rapids that wants to join our team. And once those details are known, we'll be sending out both email blasts as well as marking it on our website that is available. But now, currently, we already have a clinic in Lansing. So if there's patients closer to the west side of the state that want to see us at that Lansing facility, we could accommodate you now. And in the very soon future, we'll be able to see patients in the Grand Rapids area.
And then for the immediate one, we also still do telemedicine consults here in the office. So we can do that here, so that minimizes any type of travel time and then only schedule the procedures here when you're ready to do it.
Yeah, that's a good point. The consults we'll be doing in the west side of the state will be consults. The facility that you got a great picture of today takes time in order to build enough a patient base to justify investing in that kind of equipment. That state-of-the-art equipment in the ORs that allows us to visualize the tissues and make sure that our needle placement is extremely precise. And then that regenerative lab that has the specialized equipment to process the cells, highly concentrate the cells, count the cells, make sure we have the right dose. Those are two extremely important variables in optimizing outcomes. And I think that's a key point from tonight's webinar that we're not the only clinic that offers regenerative procedures. And when you're comparing us to other clinics, I think it's important to ask tough questions. And one of those should be, how do you know where your needle tip is? What kind of imaging guidance are you using? And the second is, how do you know what you're injecting? What dose of stem cells am I being injected with? And without that lab that's capable of counting those cells, my analogy is you don't know if you're getting a baby aspirin or a full dose aspirin for your headache. And just because a baby aspirin doesn't work for a headache doesn't mean a full dose won't. Well, same concept applies for PRP and stem cells. Just because somebody's injection where they don't know the dose of their PRP or your stem cells didn't work for you, well, it doesn't mean stem cells or PRP doesn't work. It just means that you might have been under injected. You might have been given an inadequate dose. So that lab is a critical factor in getting a good outcome. So while we build our clinic and our footprint on the west side of the state, we'll still be asking patients to come to this facility for their procedure in order to get the best possible outcome.
This is the world-class facility. That's why we decided to make it this way. That's why we wanted to make it bigger, because this is going to be a destination. So if you want to get the best regenerative medicine treatments, regardless of where you're coming from, you come here at the Michigan Center of Regenerative Medicine here in our facility. This is where to go.
Another question about X-ray. Will we have X-ray at this facility? Unfortunately, we decided not to.
Yeah,
we looked into it, but we do have the fluoroscopies, which are sort of X-ray, but we decided not to do digital X-ray.
Yeah, we decided against that because it's going to take up a critical space that we thought we could utilize here for our patients. And every once in a while, if someone comes in, they didn't have an X-ray and our fluoroscope is not busy, then you can take a quick X-ray of a shoulder joint or something along those lines. So, but we don't have actual dedicated X-ray facility here.
Another question coming in is, do you have a DEXA scan on site? Not yet. So that is a piece of equipment we've already ordered. It should arrive mid-February. We hope to have that up and running shortly thereafter. And again, as soon as we have that service available, we'll be sure to send out a message to our patients and mark it on our website as well. But right now, no, but in the very, very near future, we should.
Treat patients.
Yeah, do we treat patients from out of state?
Absolutely. So just like Dr. Nabby said, we can do a consultation via telehealth, even a phone call if that's necessary, and we can try to work up symptoms over the phone and then decide whether or not your treatment, our treatment is appropriate, and then you would come here for treatment. So absolutely. Out of state.
Follow-up question to the DEXA scan. What is the DEXA scan used for? So there's it's a piece of equipment that can dissect the body, that can analyze the body, and tell you exactly how much of your body weight is coming from mass or body mass is coming from muscle, fat, water, and bone. Most common use in the medical community right now is for bone density. So assessing people for their compression fracture risk by looking at their bone density. But as we move into the functional medicine space, hormone replacement therapy, supplement therapies, looking at body mass and changes that we want to make towards that body mass, increasing muscle mass, decreasing fat mass, that technology is the most accurate way to assess how much of your made is made from what sources.
Another question is, I see, is do we do multiple areas on the same procedure day? And yes, we do. We're able to do that, especially with the stem cell treatments. Again, as we've mentioned several times, because of the lab and the volume that we're able to do at once. So we do that all the time, multiple large joints, a couple of areas of the spine or spine in a large joint. So that is definitely a possibility.
So a lot of it will depend also on patient comfort as well, because the treating recovery from regenerative medicine procedures can be uncomfortable. So that's one piece that we consider as well. And like Dr. Farhad said, it all depends on the areas that we're treating. You always want to be really cognizant of how much cells or biologic we use, because a lot of the treatments, prognosis and results depend on the concentration of the cells. So you want to be able to find that right balance where you want to treat as much as you want, but at the same time, give it the right concentration that you can focus on healing the areas that you need to.
So great questions. We really appreciate it. I apologize if I miss anybody's. There is one earlier that I look like I missed, and it has to do with, are we doing any studies for stem cells for knees? I don't know, John, if you want to take that one. You presented some data.
Yeah, so there's a lot of data that's published, good data for regenerative medicine treatments and stem cells for the knees. The biggest issue with looking at published literature is that there's no standardization. The problem with that is even highly respected journals, highly respected facilities that churn out these studies, a lot of times they don't quantify the cells when they do these studies, and therefore the results that's published are kind of all over the place. So one of the things that we've learned now is that when we look at these studies and analyze the importance and the weight of the studies, we need to be able to see what the dosing of the cells are, how they were created, quantification, and looking at the data behind the inject data is going to be important, and kind of see how the results are done. So when you look at it that way, and then you see that there is a minimum dosage that you need for stem cells and PRP, that once you kind of meet these minimum thresholds, the outcomes are typically predictable, and there are very good outcomes. It's just a matter of finding the right ones and being able to weed out good studies from mediocre studies.
That's the challenge, I think, because unfortunately most of the data that's available in the published studies are typically what we call meta-analysis. So they'll take several different studies and they lump them together, not necessarily looking at the details of what each study has done, and then make an outcome based on something that is not accurate. So it's tough right now because, as Dr. Santa Ana has mentioned, there's really no standard. It's sort of depending on the facility, do they have a lab, do they quantify, et cetera. So our data, we have data that we have been tracking demonstrates improvement of 80% of symptoms. Again, a lot of it depends on the severity of the pathology, but we're talking about relatively moderate to severe arthritis, people looking at joint replacements with benefit of 80% of improvement from our treatment. So that's our data, not someone else's.
So yeah, when you talk about there is no standard, that is our goal. We are looking to set the standard, and tracking outcomes is one type of study where you're prospectively looking forward at your patients, documenting initially what their baseline levels of function and pain are, documenting what and where you injected, documenting how severe their condition was, and then tracking their progress over time. And with the assistance of our lab, Great Ledge Technologies, as well as another data biologics patient registry, we're able to get very good data that since we've been doing it long enough, have out to 2-year outcome data that Dr. Santana presented at one of the most prestigious regenerative conferences, Toby, last summer. And our outcomes are extremely good, and we have data to support that. So that's part of our mission with this new facility, is to be able to spread that knowledge and be able to get this to become the standard of care. What other treatment modalities are you looking to add? I mentioned a couple. I don't know if you want to add, maybe elaborate more on the sexual wellness.
So we're looking at some of these sexual wellness therapies for erectile dysfunction, for women's sexual health. Those are big areas that are sort of not addressed in traditional treatments. Without getting into too many specifics, but those are the areas we're looking at adding, and also an aesthetic component. So Botox and things like that, fillers and vampire facials potentially. So all these things down the pipeline.
Hair regrowth, right? Female urinary incontinence, and then also functional medicine. There's a lot of the things that we do here in regenerative medicine kind of hedges on the overall health of the patient. So the healthier you are, the outcomes are usually better. So just to kind of look at that more holistic overall evaluation of the patient, I think it's going to be important to look at that as well.
And to kind of piggybacking on Dr. Santana's comment there, this isn't a stretch. Why would we add these service lines? The type of treatments we do are connective tissue-based treatments. So we're doing and stimulating growth and healing that promotes collagen formation. And what's our skin made out of? Collagen. What's our pelvic floor in a female stress incontinence and female sexual dysfunction? The pelvic floor is muscles and tendons. And those are all things that our lab and our injections already stimulate and heal in the orthopedic world. So taking that extra step when we're stimulating hair growth with collagen formation, it's all the same concept. It's just a different area of the body. So we're taking the benefits of our office and particularly the lab and our skills as clinicians and placing needles accurately, and just treating other areas of the body that also have a very similar response that our orthopedic patients do. How long have you been doing stem cell therapy?
Long time.
So the three of us actually have date back to an original conference, and we founded this company shortly after that conference in 2017, and have slowly transitioned our careers towards a regenerative medicine focused practice. We still offer the traditional pain therapies and the traditional medication that you would think of when you think of going to a physical medicine rehab specialist and pain specialist like the three of us are. But we've been doing it almost 10 years. So 2015 was that original conference, and I think the original patient we treated was in 2016, which is in the regenerative medicine world a long time.
We're actually one of the biggest contributors to the data registry for regenerative medicine based on the longevity that we've done it and the amount of patients that we've treated already. So we're proud of that.
Yeah. We had a question come about publications. Have we published any peer-reviewed medical journals? That is a process that takes an incredible long time, but happy to say we have our first published study, and we have over a dozen in the pipeline right now. So as those studies roll out, we'll certainly make more announcements of that. But it is quite a process getting those studies published, presenting the data, having it agree or accepted, and then fine tuning all the details of a manuscript is a long process. But we are very close to having multiple studies being published. I think we hit most of these. What are the treatments modalities?
I can't read that.
Yeah. Oh, are your doctors specialized in different areas of the body? I think that's a very good question. It's something we've kind of talked about, but as of now, we all treat everything. I don't think any of us have any one particular specialty that's developed. We don't have a knee guy or a hip guy or a shoulder guy. We're all still excited to treat everything, I guess. I'm speaking maybe more for myself than you all, but I still enjoy the variety. So I don't have a plan to subspecialize in any way.
Right. I agree.
All right. I think we got to most all the questions tonight. The timing's just about right. We like to keep them to 30 minutes or less, and we're right up on that clock. So appreciate everyone that's tuning in. I think this might be the most we've ever had in a setting on a live basis. These are recorded. They are posted to our website. We'll shoot them out in an email blast as well. And if anything that we talked about or showed you today piques your interest and you want to come in for an in-person scheduled appointment, we'd love to see you. Michigan Center Regenerative Medicine, 248-216-1008. regenerativeMedicineMichigan.com. I think that's about it.
All right. Good night. Thank you.
Thank you, everyone.
Thanks, everyone. Have a good night.